Welcome to Sexually Charged Radio, co-hosted by Ruth Newstifter and Thomas Sasso.
We and our guests discuss your questions about sex, sexuality, and gender in a sex-positive, safe, and educational manner. Welcome to Sexually Charged Radio. I'm Ruthie, and I'm here with
Thomas.
Hey, Thomas. Tell me a little bit about yourself and why you keep doing this show every week, every month, whatever it is that we do.
So I don't know if you know this, but I have the absolute best co-host in the world.
I did know that.
Yeah. Oh, okay. Well, that's.
But no, you can say more, please.
Yeah, I've always wanted to be on a radio show. Mm-hmm. When I was younger, working at a retail store, I would do the announcements on the radio, and customers would come up and say, "You have a voice for radio." I was like, "That's great." And they're like, "And you have a face for radio too."
Oh, Thomas, you went there.
Oh,
you're beautiful, Thomas, in every way, physical and not.
Oh, well, thank you, Ruthie.
And that's totally authentic. I don't say that to everyone. Sometimes I'm just like, oh.
Got a public love fest going on.
I know, right? Here we go.
And what about you, Ruthie? Why are you doing Sexually Charged Radio?
So when I was a young little nerd, I really liked this TV show called, what was it? It was Adam Carolla and Dr. Drew. It was Love Lines. It was on MTV at the time. And it also had a corresponding radio show. And people would ask sex advice questions live. And the two regular hosts and then their guest hosts would discuss it. And I always thought, what a great format. I would love to be on that and do it better. And I don't know if I'm doing it better, but at least I'm doing it. So I was often distressed at kind of the themes that would come up in the answers from the two regular hosts. But, we each do things our own way, and they were immensely popular. So I am doing it. And I'm excited to be talking about sex and wellness and to have this great public forum to do it on 93.9 FM out of Guelph and at cfru.ca for folks who want to stream us online, or just search Sexually Charged Radio on YouTube. You can also email us your questions at asksc@uoguelph.ca, and the wonderful student interns over at Student Wellness, which is part of Student Affairs here at the University of Guelph, will receive those questions, and some of them get forwarded on to us, and they help us with the editing. Well, they don't just help us, they do the editing, and we're very fortunate to have such great student collaborators for this project.
And if at any point you're thinking about, what we're talking about and you want to have some commentary about it, you can also email the asksc@uoguelph.ca, and we're always happy to get your feedback.
We have a couple of questions here, and some of these questions that we have today, we have three of them in this bunch here, came from doing a little outreach that I did at one of the dorms here on campus, and people submitted questions. These are non-identifying, and I checked in with some folks at the dorm first, and so these three are a little bit similar topics. I'm just going to read all three, Thomas, and then we can kind of respond to them as we go.
Sounds good.
Can you receive orally transmitted gonorrhea by giving vaginal, oral, or from receiving a blowjob? Should non-sexually active people get checked? And where can I go to get checked on campus because my parents don't know I've been sexually active? Initial thoughts as I read these out loud.
Well, I think, my initial thoughts are that this is a common conversation among campus-age generations. Talking about sexually transmitted infections often emerges at the university level or college level because the public education system doesn't do a good job about educating individuals about these things in the high school or elementary level.
Nor do families, for that matter. It's just not a conversation that happens very often, except around kind of fear and scare tactics around this. So there's tremendous stigma. So we know there's a thing of sexually transmitted infections, but we are terrified about them, and we learn kind of all this fear-based stuff, and we worry about what people will think of us, and we don't even actually know necessarily how stuff is transmitted. And that also reflects the fact that our knowledge about transmission at kind of the professional level and doctors and stuff, we're evolving with that. Research is telling us new things. So I'm looking at this one about gonorrhea here. And so for the last little while in some major cities, including the Toronto area, so some major cities internationally, there's been a kind of a little more resistant to antibiotic type of gonorrhea that ends up getting in the back of people's throats. So if you touch the top of your mouth, you have the palate there. It's kind of tap, tap, tap. You can tap on it behind your top teeth. And then if you go back farther, you might gag, but that's kind of where it gets a little softer and squishier.
Or maybe you won't.
Maybe you won't. It depends on your skill set. And that that is where that type of gonorrhea lives, according to what I've been reading anyway. So we talked a little bit about that. So that's, if people are interested in this, so my area is not medical health, it's mental health. So you would want to talk to somebody who does have expertise in disease transmission and all those things. But that's the what's going on in the press and the newspaper, that's been going around. It's been a little bit harder to treat, and concerned that it may become even more harder to treat because sometimes stuff gets more resistant to antibiotics, right? So this is a good question. Can you receive orally transmitted gonorrhea by giving vaginal, oral, or from receiving a blowjob? Traditionally, we've looked at oral sex as being a slightly less risky, or maybe even substantially less risky type of sexual interaction. So if you want to be risk aware, there might be some problems from giving or receiving oral sex without protection, but maybe not as many. And this is starting to be amended. While it may be a lower risk activity, we're starting to recognize that it does have a little more risk than we thought before, which kind of makes everybody go, oh man, I really didn't want to use protection for oral sex.
Well, and that's, I think, an interesting piece because in the communities that I'm involved in, individuals I know, friends, colleagues, and so forth, it's rare to have a conversation about oral sex that involves barriers. Mm-hmm. I can't even recall the last time talking to somebody, they talked about giving a blowjob or oral sex vaginally where barrier was used, because there is sort of this ongoing belief that, this is safe. There's no risk associated with it. This is
the free and easy type of sex that we don't have to worry about. Which is interesting because I present at sex events where sometimes there's actual sex happening between sometimes lots of different people at once. And there's classes and things that I'll be presenting along with lots of other presenters. And often at the places that I present at, it's very common for oral sex to be happening with barriers. So it seems to be within certain groups, it's seen as a norm, and maybe not everybody is doing it, but you certainly wouldn't do a double take. And when you're talking with someone and you're negotiating it, you would probably feel a little uncomfortable saying that you don't use a barrier instead of the other way around because it is so normed there. But then in the rest of the world, that doesn't seem to be so often the case.
Yeah, I know someone's at a bathhouse or in a back room or using a glory hole. It's seldom that I see a condom, being used in that situation.
And it would more likely be the person who is giving the oral sex who would initiate the condom in that. If it were to happen, I would imagine. And this question is even the opposite direction. Can you get anything from receiving a blowjob?
Yeah, didn't even read that part of the question. I got so pulled up into the... Yeah.
So my understanding, and again, I'm not a physician at all, but when we are looking at some disease, that there was concern that because if it's living in the back of the throat there and the urethras in that area of the penis, then there may be risk to that sort of situation. There's also other types of sexually transmitted infections. Anything that goes skin to skin can go in either direction, right? The lips, the mouth, the inside of the mouth, those gooey areas with the urethra, which is the pee hole in the mouth, like those are the mucous membranes. So there's a number of things that can go back and forth that way. Some are easier to treat than others.
So what would you, if this individual wrote in, what would you recommend to them in terms of precautions beforehand, during the process, afterwards?
Yeah. So we know from research that oftentimes people who recommend condoms and barriers aren't actually that good at using them themselves. So because I'm aware of that, I want to contextualize that I do actually use these things all the time, except for the very, very limited number of partners that I'm fluid bonded with, which means that within our group, we're only not using protection with each other. Everybody else outside the group, protection is used. And so I do use these all the time for giving and receiving oral sex when I'm in these other situations. And so to me, this is just a normal part of my sex life. And if there's a particular type of barrier that I don't like, I just don't do that sex activity with people. And maybe I have to really want that person in order to be able to put up with that particular activity. So I just do other things that I enjoy. But I think that's a great way to go. I live it. I totally promote it to other folks, but I would not presume to tell people that they have to go that way. So then there's other things about just being more risk aware and recognizing that you're risking things and taking that responsibility. I think probably, from the things you were saying, you might be able to better represent something that is more common, even though my way of doing it is totally feasible.
Yeah, and I think that's an important point to make, that it is completely feasible.
Totally. And it can be fun.
Yeah. And I mean, there are conversations that people have around there being less stimulation with oral sex when there is a barrier in play, and or just in general with a barrier, that there being less stimulation felt. But, I think it's part about changing that conversation. I think, there's a lot of discussion going on right now around PrEP and the pre-exposure prophylaxis, and whether that's going to result in people using less condoms. And I think ours is a time right now where we need to make some concerted choices around, well, what does our sexual health mean, and what are the sexual health risks, and what kind of behaviors do we need to do to protect ourselves from certain risks?
Could you tell people what PrEP is, and whether or not that's something people are using as far as unprotected oral sex goes?
Yeah, so PrEP is commonly used medication. It's only, I guess, recently become more publicly available. Canada was just approved by Health Canada for access, and it's meant to be now I'm losing my words.
Is it like a preventative or protective measure?
Preventative. Thank you. Oh, God, sometimes
that's what I'm here for. I got
words are just difficult.
It's true. At least I don't have to spell them here.
So a preventative measure for contracting HIV. And so there have been a number of studies very prominently illustrated in the media recently that individuals who are on PrEP have a much lower risk of contracting HIV in serodiscordant couples or partnerships.
Which means somebody's HIV positive and somebody's HIV negative, right?
Yes.
So do we worry about HIV with oral sex these days?
Yes.
Tell us more, Thomas.
Yeah, I mean, as you were saying before, any time that there is contact between two areas in which the mucous membrane can be permeable. I'm not a science person and I'm not a medical professional.
So when we're getting gooey, sticky parts together, or if there could be any blood that happens, which mouths are a place that bleed, right? You know, with toothbrushes and
gums,
biting your tongue. And I drink a lot of soda pop, so I end up with like these things that I bite in my mouth all the time, and those are all kind of, so that may be lower risk than unprotected anal sex, but lower doesn't necessarily mean acceptably low. That's a personal judgment call, right?
Yeah, and so I think that's the important part that we always remind ourselves that I don't know that when we're talking about HIV and within the HIV community that we ever really say zero risk.
Yeah. Never.
And so I think it's important to realize that oral sex does present an opportunity or a certain amount of risk, and you just need to know what risks you're willing to accommodate within your life. And some people are willing to have more risk, some with less, and that's not problematic in any way. It's just you need to communicate that between partners as to what risk you're willing to do. And so using a barrier, using a condom or a dam for oral sex is, good practice across the board. I don't think it happens as often, particularly within the gay communities.
It surely doesn't.
As it used to. But if you're concerned because you don't know your partner's status for any number of STIs or bloodborne infections,
they don't know their own oftentimes.
That it's a good preventative measure.
So this is something that gets easier with practice, in my experience, as far as negotiating that kind of sex with folks who may not be accustomed to using a barrier with it. There's also can be some positives to using a barrier for oral sex as well. And, those will differ by the person, but you might find out there are things about it that you like as well. Can it make things a little less sensitive? Sure, it can. But rest assured, people wearing condoms for all sorts of activities are still getting off and having a good time. If it is really problematic, you may have a condom that doesn't fit you well. It may be made out of a material that your skin or your body doesn't like very much. It could be that the types of lubricants are a problem. So it also may be finding condoms that work well for yourself and your partners.
And what's more fun than just testing different condoms?
Right.
Just being like, okay, this one didn't. Let's try the next. Let's try the next.
I mean, testing different ice cream is pretty good too.
You could do them at the same time.
I'm in. So this is also reminding you that you're listening to CFRU.ca, or you're listening to Sexually Charged Radio, which you can stream from that website. We're at 93.3 FM if you're in the Guelph area in Southern Ontario, Canada. You can email your questions to AskSC, those are the initials for Sexually Charged, AskSC@uoguelph.ca, and the phenomenal students over at Student Wellness will field those questions and forward some of them on to us, and they help make all this editing and good stuff possible. So we appreciate them.
This program will cover mature topics such as sex and sexuality and is meant for education and entertainment only.
We were just talking about whether you can get sexually transmitted infections from oral sex in any direction with any genitals, and the answer is yes. So we were talking about different barriers in people considering risk for themselves, but also wanting to make sure that talking about sexually transmitted diseases and infections and other things doesn't necessarily mean stigmatizing. It means being aware, and sexually transmitted infections are extremely common. They don't make you a bad or tainted person. It's kind of a welcome to the club sort of situation. Yeah. Some are medicatable, some are curable, and some are neither. Well, I guess everything's medicatable, but some are not curable.
Yeah, and I think that flows really well into the second question that we talked about, where someone wrote in, should non-sexually active people get checked? Mm-hmm. And I think my initial reaction there is getting checked is good medical practice. Mm-hmm. Checked for lots of things, but there are also ways that when we talk about sexually transmitted infections, we now actually start talking more about it as sexually transmitted and bloodborne infections. So aspects of blood transfusions, use of needles.
Which can include piercings and tattoos, as well as recreational drug use. Or having to reuse or share things for prescription drug use if you cannot afford or cannot acquire materials for that.
So all of those activities or behaviors can present a certain level of risk associated with them. And in those cases, it's often suggested that you do engage in getting checked because different forms of infections or diseases can be transmitted in different ways.
Yeah, I mean, I have a moderate amount of body art on my person of a permanent and semi-permanent nature. And, my healthcare provider and I discussed, and I was careful in getting all of it except the cold brand, which did end up, blistered and things. So there were issues there, although I think it looks lovely now. But, we decided together that it would be a good idea to just go ahead and run a scan through things just to make sure anyway. So I knew the places I was getting these done at, and I feel really good about their cleaning procedures. But for myself, it's just part of being responsible and kind to myself and to other people who are in that fluid bonded circle with me to keep making sure of that, in addition to things around sexual activities. But I want to broaden this up a little bit too, because being non-sexually active, what does that mean, right? So for instance, at some of these events and things where I present, there might be people who are in the S&M community. And I remember one situation where I was watching something called a taste and see, or an exploratorium, or what they call like an adventure dome, or they have all these weird names where you can go from station to station and try a different kind of kinky activity, which usually has no genital involvement whatsoever, just to see if you like it from one side or the other. So maybe somebody wants to try play piercing, somebody wants to try getting spanked, somebody wants to try a little rope bondage, something like that. And I remember watching, there's a line of people who were experiencing getting single-tailed. So it's this Indiana Jones, that's a bullwhip. That's one very fierce type of single-tail. Make them much smaller and not so big and things like that. That one would be really, really hard to throw. But they wanted to feel it. And so the person who was in charge of the station was using a single tail whip in a light way. It wasn't like any kind of excruciating pain or anything like that. And I was realizing that with this particular leather item, which cannot be sterilized because it's leather, they were sometimes drawing like little nicks, like little scratches and drawing blood. And then the next person would come up and again, the same item. And I just thought to myself, oh my goodness, nobody is probably even going to think to talk to their healthcare practitioner that they went to get in a line and they were single-tailed by the same person who did this with everybody. And that was quite unnerving to think that, that's a risk factor then. 30 people that day, who knows where that was used before and how long things might be living on that surface. And probably, unless they're getting assessed for other reasons, they're not thinking about it. So there's also an awareness of factors of kind of what is sexual, what is non-sexual, what is a risk. When I was talking about this at the dorm with folks, the other thing I said is, you don't have to defend why you were going in to get checked. Mm-hmm. You don't have to say anything about yourself. You just say, I want this. And so we are fortunate in our country, in our context, that, that those can be things that are covered and free, and different people live in different places. And if you're more rural, it might be harder to get to these things regardless of where you are. But you can just say that I want this thing. And if you live in a place where you don't have to pay for it, all the better. So it also, if you feel like you want to get checked just because you want to, or just because you want to see what that experience is like, so you've been through it before the time you become sexually active, that's okay. You can just say, I want to do this thing. Just like you don't have to let your doctor weigh you. You don't have to let your doctor take your blood pressure. You don't have to give a sexual history of any of those things. If those get in your way of practicing good healthcare, you get to pick and choose what you do.
Yeah, and I mean, I've had experiences where healthcare professionals have pushed to have me say, well, why do you want to get tested?
No, thank you. I'm not going to tell you.
And I mean, those are awkward situations, but you have that right, and you have that responsibility for your own body to, take care of it. And if that's something that you personally want to get done, then... Yeah.
I respectfully decline to answer this question. Can you please just administer the test for me? Mm-hmm. If you have to write something down, say that I've decided not to answer that. Yeah. And oftentimes my healthcare practitioners in the past, now I go to a place that kind of specializes in people like me, they haven't really known what to do with me anyway. So I don't actually, I'm used to not answering their questions or just making stuff up just to get what I want, which does not lead to a very accurate health record. So I'm really glad it doesn't have to be that way anymore.
Yeah.
We have a third question that we answered in here, or that we asked in here, which is, where can I go to get checked on campus because my parents don't know I've been sexually active? Well, first of all, congratulations on this step that you've decided to take in your life. So go you. I hope that it has been a positive or series of positive experiences for yourself, and we're proud of you, whichever direction or decision you make on this. My first thought with this is that regardless of what medical practitioner you see, they shouldn't be telling your parents. Now, that's not to say that all healthcare practitioners are following the confidentiality rules that they should. They might be leaking information to your parents, but they shouldn't be. And you can also clarify with them that they are keeping this confidential. What are your initial thoughts on this?
Yeah, well, just to respond, I think, to your point there about the confidentiality, another concern can also be, a student who goes home and has their medical practices done in a different city where their parents are, and then the parents have to take them to the doctor for the testing.
Good point.
And then there's sort of that concern of the parents saying, well, why do you want to go to the doctor?
Yeah.
So there are lots of kind of ways that the parents' aspect could play into it.
True.
And that's why it is great that if you are in the Guelph area, there are a number of locations you can go.
So you can make an appointment on campus if you're a student.
Yeah.
You might need to make that appointment a couple of days ahead of time. So you just call and let them know. And again, you can say as much or as little about your situation as you want to. And that information would not be going to your parents.
Yeah, and if you're in the Guelph area, there's the public health building where you can get tested, as well at the Arch Clinic.
Those are HIV tests specifically at Arch, right?
Yes.
Yeah.
And typically at most clinics, there will be opportunities for them to direct you to locations if they can't personally do the testing there. But if you go onto the Public Health Agency of Canada's website, they do have information there available as to different locations for testing. So if you're living in different areas that are harder to get to certain areas, you can use that to find the one that's most accessible to you, because maybe you don't want to get tested on campus for varying reasons, and that's okay.
Sure.
And you can go elsewhere in the community.
for things that can be tested by urine, I was reading recently that in the Guelph area, you can actually go onto the public health website, or I think Arch has it on their website too. You can print out the order sheet for the urine testing yourself. So it's not pregnancy, that's sexually transmitted infections, and you can take that into the collection center, and you no longer need a prescription for that, if I understand that correctly. So there sometimes are concerns that if you want to go in and have an STI check, that it necessarily has to be invasive, and there are some things that are best or only checked that way, but there are other things that you can check in other ways. So if it's so distressing for you to have somebody physically check or do a swab or see your genitals or whatever the case may be, that's keeping you from doing it, you can get HIV tested without that, and there are other sexually transmitted infections that can be checked by urine, so at least you can be doing that.
Yeah, and definitely consult with a medical practitioner in terms of your options as well, because different practitioners will have different practices that they recommend or that they feel most comfortable with, but knowing your rights as a patient and as a person seeking healthcare in this region, you have that ability to be flexible in your location and in the way that service is rendered.
Mm-hmm. Absolutely. And this is a great question too, because, it also brings to mind the level of responsibility we take when we become sexually active people, hopefully, that this is all part and parcel with it. Taking care of our health is a part of being a grown-up. And when you have other things you need to take care of your health around, then, that is just the necessity of it. So I like the forward thinking with this and saying, I am now sexually involved with folks, one or more folks, and so I want to handle this myself as an adult, and this is what I'm doing. So kudos to that person as well for that. We have just another minute or so left. If we're looking at all three of these questions, do you have any closing thoughts for folks, Thomas?
Yeah, I mean, the big one for me is you're not alone in thinking about STIs. They should be on everyone's mind if you are sexually active, or as we said with the one case, non-sexually active, but active in other ways.
Yeah.
And so please don't feel ashamed. Don't feel hesitant to reach out if you're concerned. If you have anxiety around how you're feeling about your sexual health, make that appointment with a health practitioner, hopefully one that you can feel comfortable with, because you don't want to live with that anxiety or that fear around STIs. Yeah, sexual health care is just healthcare, right? So, a great thing about this kind of grouping of being sexual health care is that, there we have more options for reducing risk. And unfortunately, there's been a lot of stigma put on this because it has something to do with sex, and that's not necessary. And, I can say, feel good about yourself and don't let that stigma happen, and that won't magically erase the stigma for you, but hopefully hearing that might help a little bit. If your healthcare practitioners don't help you in feeling less stigma around it, and you have the ability to switch to other healthcare practitioners, then you might consider that as well. But yeah, sexually active or not, a good thing to be thinking about. So you have been listening to Sexually Charged Radio. You want to tell us about this? Sexually Charged Radio is available at CFRU 93.3 FM in the Guelph community, as well as on CFRU.ca. And you can also find any of our past episodes on YouTube by searching Sexually Charged Radio. And if you're interested in writing in a question or a comment about sexuality, gender, relationships, or anything that your heart deems interesting, you can email us at asksc, that's SC as in the initials for sexually charged, asksc@uoguelph.ca. Thanks for joining me today, Thomas. Thanks for having me, Ruthie.